Hey guys, this is Troy with the Advanced Spine Joint and Wellness Center here in Medina. Hey, today we're going to talk about shoulder pain and the complex nature of shoulder pain and how the shoulder blade, and the neck all work together. So stay tuned and we'll be right back. So shoulder pain is actually a really complex problem. The shoulder joint, the shoulder blade, and the neck all work together. And it's a really complex kind of interwoven batch of muscles that really make this whole complex really difficult to evaluate, diagnose, and then treat. But a careful evaluation and diagnosis leads to better treatment. Now, let's talk a little bit about the shoulder and the shoulder blade itself. These two joints actually work very closely together. The shoulder is actually a ball and socket joint. So there's a ball and there's a socket, and it's held in place by these four tendons right here that are called the rotator cuff. All of these rotator cuff muscles are actually housed here in and around the shoulder blade, which of course is on the back of our upper thoracic cage here, or the upper back area. So here's the shoulder, and then all of these muscles originate from the shoulder blade back here. Now, the other problem though is that all the muscles that attach and work with our neck also then come around over top of these muscles here in the rotator cuff. So as you can see, the muscles here in the rotator cuff, the neck, and all of the muscles that then begin to work the shoulder all work very closely together, as do the nerves that come from the neck. So they're controlling these muscles. So it's a very complex, I call it a triangle of the shoulder, shoulder blade, and neck area. So the first thing we really need to do is just formally establish a diagnosis. So what is the problem with the area? And then in most cases, they're rehabilitative. You can rehabilitate these things. In some cases, they're surgical. Now, what makes us so successful when we rehabilitate these issues is that our rehab program is focused a little bit different than most. Typically, when you hear of like shoulder impingement or rotator cuff injuries, things like this, what happens is our poor posture will begin to lead to the shoulder blade riding up and out of the thoracic cage, and this little roof over the top of the shoulder, instead of being back here, will glide forward. And what happens then is we lift the shoulder, we begin to impinge the rotator cuff between these two bony structures, and that causes shoulder blade pain. So what we do is we actually do a lot of work rehabilitating the muscles down here in the upper thoracic cage. It's called the serratus anterior, the lats, things like this, muscles that help pull when we're doing things like pull-ups. And what that does is it begins to pull the shoulder and the shoulder blade back down, rotating it backwards. Now, we usually couple that with a lot of strengthening exercises, such as movements like seated cable rows, bent over flies, things like that, that develop the muscles in and around here in the shoulder blade, and again, assist with pulling the shoulder blade back and down, opening up this space so we can then move our shoulder again with less impingement. Now, many offices or many physical therapy offices, they'll work on rotator cuff strengthening exercises with bands, things like that. Yes, those are important, but they typically miss the primary issue here, which is our postural related shoulder issues. I'm going to turn to my side and I'm going to kind of mimic poor posture that leads to these things. So we should be standing upright with our shoulders back, head forward. That's good posture, but what typically happens to most Americans from being at computers, maybe lifting, factory work, being on phones, tablets, or screens, is we start to getting into this position. And as you can see, again with this model, that shoulder blade rocks forward, and now we have a setup for impingement, neck, and shoulder pain. And typically, we have to work with all three areas to be successful in rehabilitating these things. So if you find maybe that you're dealing with shoulder blade pain or rotator cuff issues, or even neck pain, and having vague radiation of pain into these areas, maybe you need a more complex approach. Now, if you're looking for more information, you can click the little button below and you can get more information, or you can go to our website, ohiopain.com, or you can schedule an initial free consultation at 330-242-7669.